In the last 2 years since the outbreak of COVID-19 pandemic, technology was majorly applied to transform healthcare delivery and COVID-19 vaccination process. The Africa Healthcare Supply Chain Dialogue 2022, attended by Ministries of Health of 5 East African countries, saw the convection of the continent multilateral agency, technology and financial sectors, manufacturers and donor organizations who shared insight and mapped out opportunities for the continent's healthcare system post-pandemic. According to the Health Chief Administrative Secretary, CAS Rashid Aman, every link of the health supply chain is of great importance as it ensures that essential vaccines, medicines and healthcare products make it from manufacturing plant to persons who are most vulnerable across the continent.
Further discussions and interest of bringing in technology here. Early this week, the WHO announced that it has struck a deal with some of the messenger RNA technology firms to transfer that technology to 6 countries in Africa, Kenya being one of them. Some of those companies in the US, for example, Moderna, have expressed an interest to come and establish a facility here to produce these messenger, to transfer the technology and produce some of these products that are based on messenger RNA technology.
Healthcare is one of the sectors hardest hit by supply chain challenges during the COVID-19 pandemic. Stakeholders in health services provision, including government and industry players, have been called on to leverage technology to mitigate against risks, build efficiencies and resilience moving forward.
COVID did this to us. COVID reminded us that, you can have all the power, all the knowledge, all the money, all the medicine, but if you don't have the mechanism to respond to certain needs on time, if you don't have a framework to get people or actors to work together seamlessly, then there's a challenge. That's what we actually learned from COVID.
The forum, convened by Zitova, Safaricom and the Ministry of Health, drew participation from government officials in Rwanda, the Democratic Republic of Congo, DRC, Uganda and Tanzania, with the aim of identifying opportunities for collaborations between private sector, public institutions and key stakeholders to redefine access to healthcare across the continent.
Our mission in Safaricom is about transforming lives. And when we talk about transforming lives, what we look at is you as an individual and you as you go about doing your work. In the last 5 years, we've decided to focus on 3 core industries: health, education, and agriculture. Agriculture, because we believe that as we help to digitize agriculture, we're going to be able to create opportunities for the youth to engage in agribusiness. Education, because we believe that education is the baseline, it's the basic that we need to ensure everybody gets an opportunity to upgrade themselves.
The summit, which will be held across the key hub of African regions, will consequently move to establish collaborations with government and partners to strengthen national supply chains, focusing on data and technology policy and regulatory frameworks, operations and processes, and financing and resource mobilization.
Right then, gentlemen, thank you.
Dolly Mirigi, Hope TV Newswatch.